Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and you have found the Truth Behind Dentistry podcast. And today I am pleased to be joined by Erika Flateau. Erika has been a full-time clinical dental hygienist for over 20 years. And during this time, she has developed an approach to hygiene care that is relational based and revolutionary. She is regarded by dentists as having an unparalleled ability to connect and engage patients as they discover their pathway to optimal health. It confidently educates and develops others to reach their greatest potential. And she lives in Tacoma, Washington with her husband and two daughters. Welcome to the podcast, Erika.
Thank you so much. It's so great to be here with you, Matthew. I'm so pleased to join you today.
Well, it's my pleasure. So thank you. I appreciate your time. And we are not just meeting. We've had multiple conversations in the past and already decided that we enjoyed each other and what each other is doing. So it only made sense that we should get on the podcast and record a conversation. So that's what we're going to do. We're going to have fun with some other people invited to the party. So maybe to get us started, you can tell us a little bit about the needs that you have seen in this 20 plus year chairside career that you've had that led you to decide I need to start Renew Consulting.
Well, you had me at the truth behind dentistry because it is something that I think needs to be more discussed to improve our industry. And then chairside as a hygienist, I really, of course, saw things from my perspective, and now learning more and more about the industry of a whole, I've started to also focus on dentists and their pain points. But for me, I was having experiences with patients that they were remarking on. I've never had anybody discuss this with me. I've never had this type of approach by a dental hygienist. My coworkers were starting to notice. My boss was starting to notice, like, what are you doing in your operatory? And I can serve one patient at a time that way. And I was just feeling so led to find a way to serve more people and to impact more than one person at a time per hour. The clinical skills are great and everybody needs a dental cleaning, and we have a shortage of hygienists. So I've continued to clinically practice as much as I can while still trying to implement this new part of my career.
I love relational based. Part of the reason I love it is because, like, isn't that what it all like that doesn't sound like that should have to be revolutionary in any way. Like, aren't we about relationships with people? And, so tell me maybe a little bit more about what does that look like to be uniquely relational based?
Yes, our MO in hygiene for many years, I believe, has been kind of punitive. We've lectured patients. We've made them ashamed. They dread their appointment. They're feeling like they're letting us down because they haven't done at home what we've requested. We haven't been able to partner with them in successful health because of these tactics. And there's also a relationship that inspires trust. And then there's a relationship with a doctor that also translates into patients agreeing to do their treatment. And the hygienists were just supposed to do cleanings and let the doctor come in and stand quietly in the corner and let the doctor do his or her exam. And then that was it. And the patient spends the most time with the hygienist. So first of all, figuring out that patients are not motivated by shame and regret. And then really getting a read on each person and having a customized experience with me where I meet them where they're at, not impose my way of, we were talking about love languages. It's kind of the same thing. We're meeting the patient where they need to be loved or cared for. And that has just blown my mind how effective it is. And hygienists are caregivers. We're empaths. We can feel the room and figuring out how to get our patients every single time they're coming back in and they're still not flossing or they're still not agreeing to that crown. Okay, we got to try something different in our industry. And that is what this approach I came up with. And I'm so excited to share it with people. I want to shout it from the rooftop. And the patient has had an experience with me for 40 minutes where we've discussed their outstanding treatment. We have talked about something that I've taken a photo of, sat them up and helped them understand the x-ray or the charting. And by the time the doctor comes in, I'm handing the doctor this neatly wrapped little gift with a bow on top. And all he needs or she needs to do is confirm and agree. That is, but I leave the door open to the doctor having possibly a slightly different opinion so that they don't have to undermine me and say, no, I don't agree. We're going to always see what the doctor has to say. If it's pre-diagnosed and outstanding treatment, I have had a conversation with the doctor previously to gain his or her permission and autonomy to go full steam ahead and recommend that treatment and why. That's such a great relationship with the doctor, and they love it. They don't even know what's happening. They're like, this is amazing. So it's very new in my opinion and not being done enough. And I love teaching people how to do it.
Yeah. I think that's awesome. I mean, you kind of had me at shame and guilt. I mean, it's like, I just feel like that's the story, because I've been on the planet longer than you, right? Which means had more dental visits, probably not. I mean, I'm not doing hygiene visits like you did, but I mean, I've been in the chair enough times with enough guilt and shame, even when I felt, I mean, there were times where I knew I hadn't been a good boy.
Yeah.
But that's even language is probably appropriate.
Right.
Ready to be punished. But there were other times where I felt like I was really trying. I was really felt like I was doing my best. And still this is the emphasis on I'm falling short, I'm failing. And so I've dreaded dental visits, which is interesting that I kind of live in the dental world. But as a patient, I've dreaded dental visits more than most things in my life, actually.
Yes.
And
Yeah.
I'm excited, really, truly excited to hear what you're talking about, because anything that changes that experience, that kind of the narrative process,
Yes.
I mean, it is revolutionary. I mean,
And
it
then
doesn't
you
seem
have a
like it should
patient for
be.
life. You've got a referral source. You have a person that's going to 100% buy into what you are partnering with them on. And then you are going to have the doctor so busy, he or she's not going to know what to do with themselves. And that hygienist is also having a completely different experience in his or her operatory all day long, because they're doing more than scraping plaque.
Right. Yeah. And the case acceptance percentage numbers are
Through the
typically
roof.
abysmal.
Yeah.
That So anytime you can get out of the silo of those roles, like this is, like you were saying, and the height and bridge across with better communication.
Yes.
And I've often felt like there was so much more for hygienists to not only to be capable of doing, but to be invited to do, which I think is part of, when you say that's part of the dilemma that we're in from the hygiene shortage and stuff, is the lack of reward and fulfillment.
Yeah.
Which is driving like if I'm worth more money, but I still don't think that there's fulfillment just because we're getting paid, we're insisting on getting paid more, or we're not going to work for you. But it feels like there's so much more than that.
Yes, absolutely. And when the doctors are willing to meet with their hygienist and really empower them to have the autonomy to speak on their behalf, and that trust is there, hygienists are not, I mean, we're hard workers. Going through hygiene school is very rigorous. We are bright people. We're very capable, and we're being underutilized, and that's very uninspiring.
Yeah.
And so, yes, the market is what it is right now. But why are hygienists not wanting to do this job? And if they are willing to do it, they need to be paid extraordinary amounts of money to muscle through it. It's just unsustainable. So the doctors, okay, the market is what it is, and the wages aren't going away. So how do we, as practice owners and dentists, deal with it instead of just being angry and resentful about it? How do we get our hygienists to be more profitable to make up that margin? And it's not going to be with more volume and burning them out more and having high turnover. And what does turnover cost a practice owner? A lot, plus your reputation with your patients, because they see people come and go constantly, and it speaks volumes. Patients are frustrated. And so what are we going to do to have our hygienists be productive, inspired, and love their job? And I feel like I have the answers to that.
Yeah, that's great. So in terms of the you talked about not just being with one person for this allotted window of time. Can you say a little bit more about kind of the carrying of multiple patients or conversations? What does that look like a little bit more?
Well, in clinical practice, I'm still able to be with one person at a time and they get that customized experience with me. But when I say I have this feeling I'm being led to help others, it's where I'm coaching hygienists and doctors, even front office people, because there's a true relationship between the hygienist and that handoff with the front office person. Otherwise, everything they've done in the room is in vain. So there's this translation to the front, to scheduling, to case acceptance, and the financial end of it that is important. So I'm really working with all team members. When I started this, I was only going to be working with the hygienists. Surprise! And so that's how I'm impacting more people at a time. So, and then by being on podcasts, speaking to wonderful people like yourself, being able to go to dental conventions, being able to write. And I've been trying all sorts of things over the last 2-3 years to expand my impact in the way that I can serve. And it's no effort for me because I enjoy it so much that when I'm able to speak to other people and encourage them and have them be uplifted and try something new, I know that it's right because it's not work. It's a passion and a really authentic thing that flows from me. I guess I should say it can be tiring, and so there is work involved, but it's worth it. And it's not something that is draining me. It gives me energy.
Yeah, well, I feel your enthusiasm, so I know you're on to something good. We've already been kind of talking about this being the Truth Behind Dentistry podcast, talking about some truths already, but is there something more you would want to say about what is going on in the world of dentistry that people are not really seeing, acknowledging?
I think I touched on it a little bit before, but the burnout that hygienists are experiencing, and then this battle between the doctors and the hygienists as far as the wage and the employment issue. We have to really ask hard questions, and instead of continuing to fuel resentment in the battle between the two departments. So doctors, if you are willing to open your minds to a different model of hygiene it's not going to be where your hygienist isn't submitting procedures and being productive. I have been able to have hygienists go above goal every day, but feel more fulfilled. And so if they're willing to open their minds to a bigger picture, long-term goal with their hygienists and invest the time in them and the coaching, they're really going to reap the benefits of that long term. So that is what I feel like we're not talking about enough. I'll read an article that'll say how to reduce your burnout, for a hygienist. And it's like, well, go to CE and find some people that are doing something different, or maybe try to expand your career into something more. Well, no, we need some rank and file hygienists out there that are willing to be doing. Everyone needs a dental hygienist. Everyone does. And so it's not a luxury. It's an absolute health need. And there are not enough people to serve those patients. So what we're doing is not working. Expecting a different result by doing the same thing, you know what that means. And so I'm really, really hoping that this message is willing to be tried by the people in my industry. So pain points: the wages, the lack of employees, and the turnover. Doctors, you have the power to make a difference in your practice, and you have to do something different. Please try a new approach that's going to empower your hygienist and give him or her the autonomy to become more than just their job description. People want to grow, they want to learn, they want to become experts, they want to feel like they are not only your employee, but they are your asset, and you're almost like an associate. I've had a doctor say to me, "You're the closest thing to an associate I've ever had." And I can't tell you what that did for me. I was like, yes, I want to live up to that. I want to grow into that. Yeah. That was fantastic. And it just fueled my fire for learning. Why does he recommend something and why does he not? learning his philosophy, finding out if I agree with his philosophy, then becoming an extension of him. It was just a totally different day at work.
Yeah, that's great. So when you think about those pain points,
Mm-hmm.
and then as that relates to, I mean, the burnout on the one hand, but also I keep thinking about the value delivery,
Mm-hmm.
profitability, value delivery per the wage paid.
Mm-hmm.
What do you think what is the primary problem, do you think, that's been keeping this stuck? Is it a lack of vision, maybe on the part of the doctors, for how the hygienist could optimally
Mm-hmm.
deliver greater value? Is it the reluctance or the inability to communicate and collaborate more effectively? Is it just that there's the tendency to be speaking two different languages that, and in two different rooms, two different languages across two different rooms that we can't seem to get beyond? Or what's the holdback here on this?
Well, whether you're insurance driven or a PP or a fee for service practice, insurance, we know that the reimbursements are what they are. And hopefully if we keep submitting new things, they're going to start agreeing with us, but it's a very slow process. So the wages are here, but the reimbursements are not, right? So if the hygienist is given this growth opportunity, they can not only start co-diagnosing and recommending more comprehensive treatment with the trust that they've established and the time that they have with patients. The doctor does not have that time. The hygienist can then translate that into work in the doctor's column, which is a practice builder. Then also, if the hygienist is allowed to be given the autonomy and the space and the time to properly diagnose periodontal disease and get the patient in for adjunctive procedures and more frequent cleaning schedule, then the hygienist is going to be diagnosing a lot of unfound work in your existing patients. Everybody's always so concerned about new patients, which is great because you have attrition and you have to account for that. But you have so much work sitting right in your own charts, in your own active patients, that is going either unfound or unscheduled.
Yes.
And so when you have a powerhouse in your hygienist department that's ready to take this on, it's going to reduce your liability. You're going to have so much hygiene work, you're going to need to find yourself another hygienist, because now you have patients that need to get in more often. And big secret, not so big secret, the doctors that are really providing this space for hygienists, they have hygienists. The ones that are not providing this space, they're doing cleanings themselves. So the hygienists get to be really picky. And if you're going to stand out as an office, it's going to give the hygienist this autonomy in this space to have a job that is very fulfilling and where they're really making a difference with your patients and properly diagnosing or co-diagnosing them and treating them. If we have an adult practice, and you have 15% of your patients that are periodontal cases and being treated as a periodontal maintenance, there's a big problem. So it's right there. It's in your practice. If you have somebody that has the knowledge to do it, allow them to do it. And if you don't, get them someone to coach them on how to, institute this protocol.
Yeah. I mean, you're just stimulating all these different thoughts. This is good. So I'm thinking also that the typical approach to try to generate more hygiene-based revenue to offset higher wages is to push harder, push faster, see more volume. But based on what you're saying, I'm guessing you would also say that what that's doing is, in that rushing, is cutting down on the ability to engage and help diagnose at a level that's going to be ultimately far more productive for the dentist than by like whipping the horse to go faster around the track.
And that's the big picture I'm talking about. If they can have that vision that if we start operating this way, it is going to pay off big time, but it's an investment.
Yes.
And so I typically, when I am in clinical practice, I see one patient at a time. I dictate how much time I have with that patient, but I am always paying for myself above and beyond. Mm-hmm. There's one or 2 days a month I will help out one office with some accelerated hygiene because they don't have a hygienist and they are in such dire straits, and I have a fantastic assistant that I can work with and I can do that. I don't believe it's compromised care. It's a different care model. And I can coach on how to do it where the patients feel like they're the only person in the world to me at that moment. They're getting the comprehensive communication between me, the doctor, and the assistant. And it's not an assembly line. It can be done, but it's not my favorite because I'm writing, 15 to 18 charts that day. But I do help them out because people need care. When they are able to get their full hygiene team, I really look forward to coaching those hygienists and having the co-diagnosis experience for those doctors. In an ideal world, I know we've got ideal and reality. In an ideal world, the hygienist sees 7 to 8 patients a day. And if they have a new patient or a periodontal procedure, they're given 2 hours. The new patient experience is people leave with their minds blown. I've never had anyone spend this kind of time with me. I love this place. I'm going to get my husband to come here. You've answered all my questions, and I'm able to talk to them about the doctor and why I work for this person and how they've chosen the right practice. If your hygienist is having to do this in 50 minutes, that's all gone. They are in survival mode. So really being able to have the time will pay off dividends big time. It's just really having the doctor that's willing to see it. Yeah. They're my client, not the one that wants to shove in more volume and give their hygienist a shorter career.
Yeah. Thinking that some of your clients can be, like I'm thinking right now, those people who would be doing what you're saying of wanting to shove more people, but because they don't know otherwise. They don't know how to do it. So there's that place of being open and receptive. It's like, this is an alternate approach. I'm open. I just didn't know.
Yeah.
But the other thing I'm thinking too is you mentioned about insurance. I'm seeing the merits of this regardless of insurance or fee for service. But I'm thinking too that for those who have moved to fee for service, are moving away from network insurance toward more fee for service, this becomes wiser, maybe even more needed to capitalize with the extra time, maybe that you've freed up as you've cleared out some of those people who are there just because you're cheapest on their list. But now you want more relationship, depth of relationship, the hygienist to help as a co-diagnostician. Right? Doesn't that make sense? Is that part of what you're helping people understand, how it fits into that continuum of network to fee for service?
Sure. And patients that follow you to a fee for service model are there for the reasons that align with your philosophy. So, you can have success in your hygiene department in either model, but it looks very different. The coaching, the service is always there, but the coaching looks different on how we're maybe going to approach this patient, because that's going to be a different personality type. And Matthew, you're really into personalities type. I know that, figuring that out. Yeah. And so, I have gotten better throughout the years at being able to read my patients and really, there's a person that sits down in my chair and I can tell right off the bat for 30 minutes, they're not going to be ready to talk about that crown. I mean, they're not even bibbed up yet. And I'm, we got that crown outstanding in your treatment plan. We really need to get that scheduled before we leave. And this patient might be somebody that needs to really sit back, relax, remember why they trust me. And then I take a photo, sit them up and gently talk to them about it. Those things can stay in both models. But when you're fee for service, there may be obviously a larger majority of your patients are there for the reasons that align with that doctor. They don't care about time. They charge for their time. You go up to the front desk and this patient's not going to blink at a $3,000 bill because they are there for the reasons that they just wholeheartedly believe in that doctor's work. If you're being chosen because you're cheapest on the list, your hygienist can still do great work that provides wonderful care, but our philosophy is a little different at this point in your career, and we got to work with that. So I don't know if I'm answering your question the way that you were hoping, but you can certainly ask me to expand, but it's so customized. Yeah. It is very doable and very ethical in either model.
Yeah. Yeah. No, I think you answered it enough. So,
okay.
And I think this is such a big deal because I have clients that have completely extricated themselves from being in network. I have others that know they need to. I have others that are part way, that have become more selective and gotten out of some. And I'm just have been looking, it's on my mind because I've been looking at the elements with more and more people to make to get that freedom, if they're looking for more
Yes.
independence from being in network, then this just makes sense as I'm listening to you to see the value of what you're saying for that group of people. Not that it's in any way antithetical to those who are completely content in the insurance world, but anyway, so this has been fantastic. The time has flown by because I mean, I love your energy, I love your enthusiasm for this, and there's so much wisdom in what you're saying. I mean, it resonates with my own personal experience as well as what I'm seeing clients wrestling with. So I already know I need to make a couple of people have already come into my mind that I need to introduce you to. So for those who are going, I got some new insights today, and I think I might need some of Erika's help. What's the best way for people to find out more?
Well, my website is renewconsultingservices.com, and you can click on, book a discovery call on there. I'd be happy to speak. And then my email is my name. You could put it in the show notes. It's erikaflateau@gmail.com. So ERIKAFLATEAU @gmail.com. Thank you so much, Matthew.
It's been my pleasure, and thank you, Erika. I just appreciate the time and the wealth of experience and wisdom that you came to share today. So thank you. Thank you. So thanks everybody for being with us. I hope you enjoyed another episode of The Truth Behind Dentistry with Erika Flateau. Please subscribe, tell your friends, and just even today, how many of your friends needed to hear this message? So please share it with them and then tell them about this podcast and checking out what we're doing. So we look forward to seeing you the next time. Thank you.